Which clotting factor is most sensitive to hemodilution during CPB? A. Factor 2. B. Factor V. C. Factor 7. D. Factor 8. Answer: B. Factor V. Explanation: Factor V is one of the most sensitive clotting factors to hemodilution. Since it's not vitamin K dependent and has a relatively short half-life, its levels fall rapidly during CPB. Which method is not typically used to reduce transfusion requirements during cardiac surgery? A. Acute normovolemic hemodilution. B. Use of antifibrinolytics. C. Preoperative warfarin. D. Intraoperative cell salvage. Answer: C. Preoperative warfarin. Explanation: Warfarin increases bleeding risk and is generally stopped before surgery. The other techniques actively help minimize transfusion needs. Which of the following most closely reflects functional platelet integrity? A. Platelet count. B. INR. C. Thromboelastography, TG. D. APTT. Answer: C. Thromboelastography, TG. Explanation: TEG assesses the functional status of clot formation, strength, and fibrinolysis, including the contribution of platelets, making it superior to routine labs in guiding transfusion. What is the mechanism of action of protamine sulfate? A. Enhances factor XA. B. Inhibits thromboxane A2. C. Direct thrombin inhibition. D. Forms a stable complex with heparin. Answer: D. Forms a stable complex with heparin. Explanation: Protamine is a positively charged protein that binds to negatively charged heparin, neutralizing its anticoagulant activity. Which of the following is least likely to be a cause of excessive bleeding after CPB? A. Hypothermia. B. Thrombocytopenia. C. Residual heparin. D. Hypercalcemia. Answer: D. Hypercalcemia. Explanation: Hypocalcemia, not hypercalcemia, can impair clotting. The other listed options are well-known contributors to bleeding post-CPB. What is the most common cause of early re-exploration for bleeding after cardiac surgery? A. Coagulopathy. B. Surgical bleeding. C. Heparin rebound. D. Hypothermia. Answer: B. Surgical bleeding. Explanation: While coagulopathy is important, surgical bleeding, e.g. suture line or graft leaks, is the most frequent cause of early re-exploration. Why is calcium often administered after CPB? A. To reverse heparin. B. To enhance platelet count. C. To improve myocardial contractility and coagulation. D. To raise hemoglobin levels. Answer: C. To improve myocardial contractility and coagulation. Explanation: Calcium is necessary for muscle contraction, including the heart, and clotting factor activity. Hypocalcemia may result from citrate in transfused blood. Which of the following is a side effect of excessive protamine administration? A. Hypertension. B. Bronchodilation. C. Bradycardia. D. Hypotension and pulmonary hypertension. Answer: D. Hypotension and pulmonary hypertension. Explanation: Excess protamine can cause systemic vasodilation, leading to hypotension, and pulmonary vasoconstriction, which may be life-threatening. Which of the following blood components is typically not included in the CPB circuit prime? A. Heparin. B. Packed red blood cells, optional. C. Fresh frozen plasma. D. Crystalloid solution. Answer: C. Fresh frozen plasma. Explanation: While crystalloids, heparin, and sometimes RBCs are used in the CPB prime, FFP is not routinely included unless there's a coagulopathy or need for volume with clotting factors. What is the role of antithrombin 3 during CPB? A. Platelet activation. B. Enhances fibrinogen conversion. C. Cofactor for heparin's action. D. Breaks down clotting factors. Answer: C. Cofactor for heparin's action. Explanation: Heparin exerts its anticoagulant effect by binding to antithrombin 3, which in turn inhibits thrombin and factor XA.